talk about short-term medical volunteer experiences. These are essentially trips that, according to literature, typically last between 14 to 90 days. It usually involves a medical student or resident or physician group from a high-income country going to a lower middle-income country to provide healthcare, conduct research, provide preventive services, things along those lines. That's the definition of that noun. One other noun that you may be more familiar with, and that is definitely a bit more of a dirty word and a catch-all kind of, is voluntourism. And obviously this has gotten some recent flack in the media. Essentially, it applies to both the sort of short-term medical work that I described earlier, but also applies to any sort of short-term volunteer work, which could be like undergraduate students, high school students, you name it, who basically go abroad for altruistic reasons and go paint a school or go to orphanages, that kind of thing. And in general, when you see this word, or when people think of volunteerism, they kind of think of it as a no-no. They see it as self-serving. And we're going to go a bit deeper into sort of the way it's portrayed. So with popular media, you basically have increasing awareness of the issue with short-term volunteer work abroad. And on this side of the pond, I actually really appreciate the fact that there's a bit more of a structured debate. Generally, there's sort of people who are for or against, trying to figure out where it stands. Certainly, there are definitely a lot of concerns raised with such work. On the side of the pond that I'm from, generally, it's a lot more negative. In Canada, the National Post is our right-wing paper of record, and they recently published this. I also recently attended the CU Consortium of Universities for Global Health conference in DC back in March. Short-term volunteer trips, short-term global health work is sort of coming up as a net negative in a lot of people's eyes. And medical trips are, obviously what I'm talking mostly about, but, and in general, any sort of global health work involving short-term stuff raises significant concerns. There was actually one professor who presented at the Consortium of Universities for Global Health conference who called her undergraduate students wanting to go abroad as less than the sum of their parts. One NGO, which I've blocked out here because I don't necessarily want to call this to them, but essentially from their website they have this entire training section with a module of what the worst practices are in global health, and one of the worst practices, as they say, are short-term interventions, right? And these are some of the reasons that they bring up as to why. They say, well, people who go abroad on volunteer vacations or medical tourism, it's self-serving, it's raising unmet expectations, it's ineffective, etc. All these horrible things. And then if you go through the rest of the module, it presents a bunch of anecdotes about terrible things that have happened to people who've been treated or served on a short-term medical trip. So there's obviously a growing awareness in the popular media. There's a growing body of literature about the problems. And it's very funny because us at our organization, we started out as we started out going on short-term medical trips in the Dominican Republic. And we like to consider ourselves maybe recovering volunteerists, but also maybe more pragmatic volunteerists as well. So that leads into the next definition, which I'm going to give you, which is placebo, right? Everyone knows what a placebo is. And we usually joke about short-term trips in their current form. We actually completely agree with all the criticism. In their current form, short-term trips are essentially a placebo. It's basically, you go to a community, you see some patients, you do some care, you feel good about it, the community feels good about it, but what has really changed? What difference have you really made, right? So in essence, this is essentially a typical two-part problem. The old adage about the two-part problem is that, as I said, awareness is growing, but many people are still unaware and they have good intentions. They go abroad, they post photos on Facebook, they're like, look mom, I saved the world, right? So you have those people who really go abroad with the best intentions but don't realize that what they're doing is probably not that meaningful, unfortunately. And then you have the other people who are aware of the issues, right? But we don't agree on solutions, and no one's really been talking about solutions yet. I mean, that whole module for that organization that I showed you, it basically goes through everything that is wrong with short-term trips, but offers very little in the way of solutions other than to just say, don't go, right? But here's the issue. Short-term efforts are very much an investment. This is one of our teams that we led down just in this past year, in December. We went down for 10 days to the Dominican Republic. We still have a continuing relationship with them, but we try to do short-term with a difference. We try to have people, People do their pre-departure training, people try to understand what they're doing, they understand the limitations and capacity of what they have. But essentially, it represents both volunteer time and finances, right? Institutions invest in these. And also, the receiving community abroad also invests in attracting or luring, short-term efforts. So, if we know that these are going to happen, basically, we, as I said, we agree with the problem. But the problem is that to understand the context in which the problem is there, the need obviously exists. The means also exist. And also, on this side of the pond, as within North America, there are certain societal values that, try to promote people to do charity, altruistic work, volunteerism. Like, these are things that our society values, right? And then this whole saying is apparently attributed as some German motto, but I just put it there because that is that encapsulates a lot of what people think about in our societies. They think about volunteering, they think about working. And so when we look about a solution, is the solution to stop people from going? And maybe more pragmatically, the other question we have is, can we? Can we actually stop people from going on these trips? Is this viable, right? Well, going on from here, and just see a little bit of what we're thinking. The trouble is that people are still going to go. Short of closing off the airport, canceling every flight out of Heathrow or Gatwick, people are going to go on these trips, whether we like it or not. The question that we ask is, if they're going to go, and that's the cancel bit, but if they're going to go though, can we get a better return on these investments? If you're thinking about the volunteer investment, the institution investment, and the investment of the local community, can we get a better return? Can we make these outcomes better?